Hello, everyone. Hope you all are doing well. I am Dr. Nabira Khan. Today we are starting our new batch. I welcome you all. We have a quite long journey with you as we are starting our regular courses and we keep moving with different type of subjects along with different type of PCQs and theoretical and explanations and flashcards and everything. First thing I just want to tell you because lots of people are very confused about how to book the exam and when to book the exam. So, I'll just give a very shortly such brief description that you how to book your exam, right? So, first of all, are you guys with me?
Yes, doctor.
Shall I start the session?
Yes.
All right. First of all, this is the basic steps. What you need to do is just make your account first. You need to make your account for the epic verification. I will tell you the in the next slide, I will tell you the whole prices and everything whatever written on the website, just to make sure that you have been made your epic verification account. Lots of students are asking me because I know third year students, fourth year students, final year students, lots of students are asking me that are we able to give the exam? It's not like the MLE or PLAP that you can sit on the exam without your degree verification. Because AMC require your degree verification, you can sit in the exam without your house job, but you cannot sit your exam without your degree because it require your degree verification, right? So first is to just make your Epic account. After making your Epic account, there will be an Epic verification that will be done by some a person that will be call you on a video call that will ask you for some questions and they will give you a number. After 3 or 4 days, or maybe they will give you a time period of 15 to 20 days, you will get a number by an email. That number will be used in your making in your AMC portfolio, right? So after that, because before that you have to be make sure that your degree and whatever the documents your country, because every country require the degree and one more document. In Pakistan, they require the HSC mark sheet and require their degree. So you have to verify it because in Pakistan it is not verified by HSC. So you have to verify your degree and your mark sheet by HSC first, and then you have to make your EPIC verification, and then you have to make your AMC portfolio. Similarly, in India and other countries, you have to be your verification done first, like your degree or whatever the second document they require, and then you will make your EPIC account. After that, when once your Epic verification number you get it, you will be able to go for your AMC portfolio. So it is the only exam. First you have to pay and then you will see when you are getting your seat. It's not like you are selecting the seat and then you are paying it. It is the exam. Mostly people will confuse that I just paid the exam, but it is not showing the seats. They will show you the seats, they will show you the month, they will show you the date, they will show you the time once you just book your exam. So this is what I just tell you that this is the steps you have to follow it. Another thing that is important is this is the fee that require Epic verification require $100 to $200. Primary verification, whatever the source you documents you have, it will require the 155 or $150. Also, they also charge the $30 of verification as well, and the AMC portfolio will charge for the $642. Once you just pay this price, they will show you the country, which country you will book your exam. They will show you the date. They will show you the time as well. You cannot select the time by yourself. You can select the date, you can select the day, you can select the country. Rest the time they will mention or they will give you by themselves. Those who are sitting in Pakistan, Saturday is not available for them. In other countries, in Bangkok, Malaysia, Singapore, you can give exam on your Saturday as well. Another thing is that once you just book your exam, you can even within the specific time period, you can change your country, you can change your day, you can change your date as well. But within a specific time period. If the time period is out, you cannot change it. If you want to cancel it, if it is a not in a specific date or given time, and you are changing it, your money will be deducted because there's a specific period of time. For example, I can change my date till December. So I can change my country as well because most of you have a visa issue. Maybe somebody cannot get the visa for Bangkok, maybe somebody cannot get the visa for Malaysia. So there's a specific time period they are providing you. Just get your visa done as soon as possible. Another thing, I'll come on the books as well, dear student. First, I need to tell about the thing that what it is important for the how to book the exam. Next thing is once you just book your exam, you can change anything within a specific time period. But now AMC is doing a one thing. They are after booking your exam, they are giving you 210 BCQs to solve. That is our free of cost. They are just changing their pool. They are just changing their level of difficulty. Previously, scoring system will be same, right? Like out of 500, you have to score the 250, but they are making the changing their level of difficulty. Now, those who were passed previously on the question, like they ask, like for example, what is the investigation of choice for the anyone who has come with a fibroma? Now the level of difficulty is different. Now they will ask you that what will be the investigation to reach on the CA stage 1, or what is the level of investigation you will see on the PAT scan. Now the level of difficulty of these questions are changing, but the still scoring system will be 250. It's not like you will get the 270 or 280. It will be same. So they are changing their bank. That's why they introduced that 210 questions to solve it, to see that how the bank are changing, how the level of difficulty is changing, how the guidelines are changing. So these are the practice question. You can solve it, and after that, you whatever the your course you are taking it, because we are the only one that's providing the lots of questions in the Q bank from the recall to the latest updates, and we are updating our Q bank repeatedly. So you are getting the questions again and again, more and more questions till 2009, and till up till the date you were getting the lots of recalls and lots of questions that how AMC changing. One thing that is very important for AMC will change the level of difficulty. AMC will change the question pattern of the any BCQ, but AMC will never change the topic. If a question can ask from a an ethical point of view, from a doctor and a patient relationship, they will ask you this question, but the level of difficulty, the pattern of the question will be changed. So the good thing about AMC is that the topic will never be changed. So you this is help you that how you can cover the topics. So the previous question, the bank will help you from the previous question that how the question will come. Because if appendix on the right side, it will never change, it will never go on the left side, right? So the topic will be same, the asking way and the difficulty will be changed. So once you book your exam, you can be changing it, you can be cancel it, everything will, but within a specific time or date or day. Also, if you guys get stuck anywhere, you can ask our customer service. Those who shouldn't join our case course can ask on the customer services. Next thing is another thing. If once you book your exam, that will be very important at how to cover your syllabus. This is what new update I just put it down. That two 110 questions you have to solve it. This is what AMC have done a new thing. So one thing about AMC is that it's the only exam for which anyhow you have to buy any course. You cannot cover your whole on a one go that I can cover my syllabus my own. You need mentors, you need QBanks, you need guidance because the course is very vast and the level of difficulty is very changed. At our time when we were giving the exam, we also require the mentors, we also require the courses to buy just because it's not a marketing process, it's just because we need to pass it on a one go. At the time when the difficulty level was not more than right now, we still require, if we 10 people sit in the exam, we only 3 people pass the exam. So it required three things. First, you need to buy the course, to get the help from the mentors, to get the right part, to get how to study, which topics are important, which topic you have to emphasize it, which topic you have to practice it. These things you require it. Second thing you require will be the study partner. AMC will never be done by alone thing. You require study partner along with you. So when you are getting the course, the most benefit of the course is that you will having lots of people from different countries. So they have different IQ level, so they will make you help study a lot. You will get the people from Africa, you will get the people from India, you will get the people from Nepal, you will get the people from all over the world. So that will make help you to just crack the exam. Another thing is that third thing is you need lots of practice of the BCQ's question. So you need a bank because a single student cannot buy the three bank itself. So buying the course, you will get the lots of BCQs in a one bank. It is also having the recalls. It is also having the flashcards. It is also having the breaky questions. By this way, you have a make a practice that how to crack the course. Now today, somebody asked me the important topics. Doctor, it is not like a any final year exam or something that we have any important topics. It's not any important topic. Every subject has a detailed assessment. Every subject have a detailed type of things. We need to go through it. There is not a single important topic that I can say it because AMC is a, you know, it is an AI exam. Whatever you are answering it, the next question regarding that will become according to your question. For example, if you are they are asking you any type of obstruction question and you are asking for the CT scan will be the investigation of choice, and you wrong it and you just put it that ultrasound will be investigation of choice for any type of seeing the screening for abdomen, they will just make you give you another question regarding this thing, but they will make you less difficult question. That means you have done the wrong question previously. But if you get the similar question from similar topic and it is level difficulty hard, like in CT scan, what you will see if there's a case of obstruction and what you will see in the case of X-ray, that means they increase the level of difficulty. So in this way, they make the level of difficulty more difficult. So that's your previous question was right. So whatever I told you that this is the important topic, but if you are not even doing right, your question will be different. AI means whatever you are answering it, according to it, they are marking your question. Also, because it's a scoring system, it's not a numbering system that you will get the one number, one plus for the right answer, one negative for the negative answer. It's not like that. Scoring means you will get the marks for the right answer, you will get the marks for the wrong answer as well. And they will see also this that how much wrong you have done, because it's a start. They will compare one student to another. If this give you a difficult question and everybody give it a wrong answer, they say that it's a level of difficulty is too much that nobody can give a right answer. So what they do, they will repeat this question in next month as well. They will repeat the similar question in even a whole year as well until the stats will be matched that 50% students are doing it correct. This is the one thing because it's a stats and AI system. Also, if you are doing it negative zero point 0.5 and whatever the numbering, nobody knows whatever the numbering or scoring they are doing it, but they will give you the marks as well. That's why we call it a scoring system. And again, your you have a seven or eight persons when you are sitting in the exam. Everybody get the different questions. Maybe you will get the similar questions as well, but the numbering will be different. Maybe your partner will be who is sitting beside you will be doing right, but you are doing the wrong. So you will get the more questions. Maybe I get the one question from ECG, but your partner who is sitting beside you will get the four questions from ECG, depending on what you are answering the question. So understanding of AMC is very important for you. That which exam you are sitting for. It is not like that somebody is giving you a list that do the obstruction, do the pediatric nasal flare, do the pediatric chapter of the long things, asthma, do this thing. It is not like that. If somebody is giving you the list and saying you just do this question, you will get failed the exam. You need to cover every subject from every aspect. You need to cover your BCQs aspect. You need to be very good listener for what mentor is telling you about the subject. Rest of the slides, the online lectures will be given by you who will join the our courses, but your live sessions will mean a lot. You can ask your mentor. Also, we can tell you that what subjects will be very difficult for the students. Number one, because nobody will do ethics and psychiatry in their medical school like that, the way we are doing for AMC. Like in medicine, it's a very little portion for dermatology and psychiatry. Like I guess one or five question from there. But AMC will require heaps of question because they divide the psychiatry in the child psychiatry, geriatric psychiatry, that is the old psychiatry, substance use psychiatry, forensic psychiatry. When you have done something wrong, what psychiatric or mental person act will be given to that, and the psychiatry that will be related to the substance use and personality disorders. So psychiatry will be very vast in AMC. Second will be the ethics. We can do as much as we get from the Australian medical legal advice book. We can do as much as the previously they are given it, but the ethical questions in the exam will be new. The more you can do it, the more you can logically solve it. The more you have understanding, the 80% of your exam will be good, but that 20% or 30% questions will always be new. So if you know the main basic or the pillar of the ethics, it will be good for you. Now, another thing I need to tell is gynecology will be very different in Australia. I know about the Asian countries in Asia. The first thing nowadays they do is whatever they are practicing is to do the C section. C section is still come to the top priority in Asian countries. But in Australia, it is the last resort. They will have multiple options to be delivered by normally. So gynecology will be a difficult one. Obs and gynae will be different one. And the questions in the exam will be, of course, a different one. Third will be surgery. Surgery questions because we did the surgery regarding the procedures regarding the obstruction because in medical school we are more concerned about the bowel. We are not concerned about the staging. We are not concerned about the when to follow up and when somebody is putting you on the any type of medicine like blood thinner or any type of hypertensive medication, any type of anti-diabetic medication, what to do, or anybody who has developed a varicose vein, what are the instruction for that person if somebody is having MI or develop the varicose vein and it's an emergency when to do the surgery. So these type of questions will trick you. And among surgery, they are more concerned about the vascular surgery, orthopedic portions. Orthopedic portion will be kind of very difficult for the in a way because we just did the only type of fractures that will be related to the wrist in medical school, but they are more concerning about the injuries that will be the ligament injuries, that will be the meniscal injuries, not the bone but the injuries. And what will be the conservative management for that? What will be the first management for that? So they are more concerning about this type of questions. So these are the questions you haven't done in detail in your exam, in your final year exam, fourth year exam. So that's why the surgery portion will be kind of difficult. If we talk about the medicine portion is comparatively less easy than these type of portions. Why? Because medicine have the similar things. What they twist you is on the investigations because in medicine you have lots of investigation. If a person has diagnosed with H pylori, they will not ask you simply that you will just done the stool for H pylori test. They will ask you that how you will follow up, in which test you will be follow up this person. So in this way, you have to see when you have to done the urea breath test, when you have to done the endoscopy, when you have done the test, what are the triple therapy, when it is failed, when you start the quadrotherapy, when quadrotherapy fail, how you will start the quadrotherapy again, and when you will consider is that it is a complication of H. pylori. They will twist you in the complication, they will twist you in the investigations. But comparatively, the other thing, medicine is vast, and the portion of medicine is again 60% in the exam. So it's a vast and it's time consuming as well. But it's comparatively less easy as compared to the other questions. Similarly, cardiovascular questions are difficult in exam. CNS question kind of difficult in exam. Rheumatology questions are kind of difficult in exam because these are the portion that we still again I cannot go in detail. We will just do the MI management, angina management. That's it. We will never focus on the more ECG that if it is come with the AVT, SVT, how we can diagnose it and how we can do it. Another thing, if we talk about the pediatric section, hardly if you are doing the questions right, you will just get the a pediatric question 1 to 5. But again, if you are doing it wrong, you can get the 10 to 15 question as well. Those who can done the medicine properly, pediatric will be similar, but neonatology will be opposite. Whatever the normal in pediatric will be opposite in neonatology. So in pediatric, it is way different in a way that in normal pediatrics, what we have done in our countries will be like the disease like asthma, like endocarditis. But in over here, they will ask you the vaccination schedule. They will ask you that if a person get any type of chickenpox or any type of disease that can be spread, how you will back your school kid, how many days? 15 days, 14 days. So that is a specific topic that requires the school exclusion. Also, the milestone is very important because they don't want their child to be MR or have ID. So they want just their students or they want their child to be very perfect. So they are focusing on milestones more. Dear doctor, as I told you, there is no any list of any important topic. This is what I am telling you that this is how we can differentiate it from our final year studies and from our 5 years of studies. Or if somebody who is belonging to any type of gynecologist or who is a surgeon over here, I'm telling you that how it is differentiating or how it is coming in exam and what is the difficulty level. As I told you, if you are just concerning that what is the important topic, you will just fail the exam. There is no important topic. Everything what I'm telling you will be important in your exam. This is the different point that I'm telling you that it is different from any other exams, and you haven't done in your past as well. So if we talk about we have done talk about the gynecology, we have done talk about the pediatric as well, internal medicine. One portion that is very different will be the population health. Population health will be having two type of portions. One will be the community portion. Another will be you are having the what population or what type of people are the Aussies and who belong to Australia before the Aussies. Two type of population health will cover. In one population health, you will see that how many what are the Aboriginal peoples. Natively Australia belong to the Aboriginal peoples. What are they? How many type of people are they? What type of disease they can concern? What type of BMI they have? What the normal habitual habits they have? What are the substance use that is common in them? So we will study the in population health regarding the Aboriginal people, regarding the Tonga Island people, regarding the Moori Island people, regarding the Pacific Island people. These are the people that that is the only specific for the Australia. We will discover in population health. Again, you can do the 80%, still 30% question will be new. Now, another if we talk about because population is vast, will be the community portion. So in community portion, you will get the positive values, p value, predictive values, the graphs and everything. That is also the new. But the good thing about this question is that if this question come on the Monday, They will give you the similar question. Like if they are asking you the positive value, they will give you the similar question till Saturday. But in the question, they change the numbers. For example, they are asking you for the positive value and they were giving you the population of smokers. Tomorrow, they will give you the population of obesity. The day after tomorrow, they will give you the population of hypercholesteremia. So this is the way they just twist the question. They change the number, but the formula will be similar. Today, maybe ask the positive value. Tomorrow, they will ask the negative value. But the good thing is that they will follow the pattern. So these are the stats question will be difficult, but will be easier if you just practice whatever the previously come the question. Again, it will become new in exam. So ethics, population health question, community medicine question will be new in exam. But again, their number will be different. Like 1 to 2 questions from population health, 1 to 2 questions from the community medicine. So more focus on the other questions. You cannot waste your whole exam on for this 2 question. So do this question as well, do the other question as well. Look a bigger side of picture. Similarly, it's not like that you have left this question just because it will come to in exam. No, if you do these 2 questions wrong in your exam because it's an AI system, you will get the 8 question from similar exam. As the question number will never be increased, like it's 150, it never be increased to the 200, but just you waste your questions because just because if you do the 2 questions right of the community medicine, you cannot get the similar 8 questions. Just because you do the 2 questions again wrong, you get the 8 questions, so your question number will be lessing. So equal will be we can say equal type of studies you have to require to do it. Okay, one thing is it is the in Pakistan there's a center in Lahore, it's functional in Saturday there is no exam in Pakistan. Monday to Friday, Pakistan Center is available and it is in Lahore. Again, it is functional now. In previously in 2 months, it was not functional. Also, for the preparation, I suggest everybody just try to take your regular courses. Please, who is a fresh year, don't run for a recall courses just because it's a very cheap or something. So it's for you guys that please, it's a humble request. Try to get the regular course first and then get the recall course. Don't sit in exam just getting the regular course because after getting the regular course in recall course, you will getting the lots of BCQs, 150 BCQs or 200 BCQs each subject you will get in the recall course, and that will require for you to just sit in your exam because after getting the regular course you require lots of basics for the practice. And in our recall course every mentor will get the each subject, get the each topic and give you the multiple question for it. As long as you are practicing your bcqs, you will get the lots of help in your getting your questions done. Also, this is for what I just give you for your orientation. Let's we start with our today's topic. Yes, 4 to 5 months is required for your regular course that you have to done with consistency, and then you will go for the regular recall course. Yes, final year is a good time to start your preparation. Just start your preparation. Just take the regular course and just start your final. Do the final year. Once you have done your final year, you will be a very fresh student. That students will be very lucky because they have a fresh knowledge. Just do your that will take the course. It will help you to crack your normal exam as well and also the AMC as well. So these people are lucky who are starting at the final year of your medical school because your knowledge will be fresh for every subject. So my advice is that once you have take the regular course, don't sit directly in the exam because AMC will require 6 to 7 months of consistency. Unless and until someone is very genius who can crack the exam in 3 months, it will be a rare case, but it will require 6 to 7 months of consistency. And I've seen 80% of students can give exam in a 1 year. No, only your degree is required. Your internship is not required. Yes, that's why I said that your those who are in fourth year, third year cannot sit in the exam. For this, you have to be just get your degree done. today, doctor, we have a first class of our new batch for the regular session. So this is for what I tell you for all the things. So we are starting with our new subject because I need to tell today my topic as well. I will starting with the ethics, right? So we will do some ethical questions today, and we have a session after tomorrow as well. No, we don't require any type of internship to sit in the exam. Even we don't require any type of English exam to sit in the exam. We require these things for the job purposes. No, it is not per compulsory. We just need to degree verification. We just need our provisional certificate or HSC verification, and then we have to just book our exam and sit in the doctor. It is not for the PT exam. It's basically for the AMC. So we will stick for the AMC. And now I am starting by today's PPT for the ethics question to see that how the ethics question will come in exam. The list has mentioned that in which country you are residing it, you require the degree verification, you require the verification from if you are in Pakistan, it require the HSC verification of degree and your inter mark sheet. Two documents they have required, and rest of the documents they have a list. Just get the list done and get your done from the HSC if you are residing in Pakistan, and then you can make an account on Epic verification. Once you get your Epic verification number done, then you are able to create your AMC portfolio and you can book your exam. Okay. I hope you are clear with it. Doctor, reading is not the choice. By reading, you can even clear your clinical exam, but by reading, you cannot clear your AMC exam. John Murtagh is the only reference book that will require to read it from the first. Yes, it's the new batch first session that will start from the ethics, and reading is not required. It requires lots of practice. It requires the explanation. John Murtagh is the only reference book required for the AMC. Rest of the therapeutic guideline, everything will be given by the mentor. Whatever it will be teaching you the subject, it will given you by the mentor or the academy. Nobody can buy the whole Royal College of Academic whole books. That's why we are just take the subscription of the Royal College of Australia regarding each subjects, and we mentors are providing you in each lecture. Yes, once you get your degree, once it will be verified by the HSC, you can be able to sit your exam. I am repeating the word HSC for the people who are residing in Pakistan. Rest of their country have their own verification process. Okay, so we are starting with the consent. In ethics, in the last month, they are emphasizing on two types of topics. Once will be what will be the age of consenting and what type of consent you can give and who are able to give the consent. And consent can be, it's a very basic thing that consent can be withdrawn at any time. We will do theory, we will do the basic use that will be come in the exam, and that will be from the Royal College of Australian Book of Ethical Sciences. All right. So we will get the both things. We will get the lecture as well. We will get the BCQs in this lecture as well. So first will be history taking, sexual or personal, physical examination, intimate or invasion examination, especially where the patient is young. That's why the importance of consent is very important. Consent can be given by a person itself. Can be given by the person who is, if it is under the 18, or cannot be going on the GLE competency, depending upon what age it is, depending upon the GLE competency. We will do in next slide what is the GLE competency. That is very important for you guys to understand what is the GLE competency and what type of consent we have: verbal, written, telephonic, and which situation we will be changing the media of consent. So we have a specific situations, like in situation where the outcome may be specific, such as HIV testing, genetic testing. Consent may be compliant by counseling. Pre-test counseling may be a legal requirement in certain situations. In investigation, that may be precursor to major interventions such as a screening test for cancer, counseling, and consent. A person, if somebody you said that you are having HIV, get the medicine done. Nobody can do this thing.
அவன் காலேஜில்
Consum
ஒரு இன்டர்ன் பொண்ணுக்கு ஹெச்ஐவி பாசிட்டிவ் பிரிக் ஆயிடுச்சான்.
என் காலேஜ்லயா?
please can you shut
என்ன
down
பேரா
your mic?
இன்டர்ன்?
தெரில, சர்ஜரி யூனிட்ல.
போட்டிருக்கா? பேர் போயிட்டு இருக்கா?
Excuse me, doctor, can you please shut down your mic? Thank you. Okay, so HIV will be the type of disease, or any type of cancer will be the type of disease a person cannot directly give the consent. So if there is a question regarding you have done the you have a person come to you and they say no for the treatment of HIV, what you will do? You will go for the go for the wish of the patient. But if they say that there is no counseling will be provided, HIV, cancer, these type of legal things, these type of dangerous diseases will require the pre-counseling. Once the counseling is done, and if the patient still say no, you have to respect the patient's wish. Now you have invasive radiology, endoscopy, organ biopsy. These are the type of procedures that require the written consents. It is not like that I am on the traffic and I just lost the pen and I cannot give the written consent, or I have an injury on my finger, I cannot write it down, you just do my biopsy. These type of procedure will require the written consents. Release of information to third parties. I am diagnosed with STD. For example, I am having a gonorrhea, and I said I don't want my mother to be know that I am having gonorrhea. So the doctor is complied to me. He will respect my wish and cannot tell anybody. Where consent is required, participation in medical researches. You are doing a cohort studies or any type of studies. You want to involve the people with having such type of basal cell carcinoma or something. You cannot involve the person, you cannot take his file, you cannot take anything without his consent. Even there was a question in the exam, you are having a presentation tomorrow and there is a lesion on the vulvar site and you have to put the picture on the for the presentation. If a patient is not consenting it, you can ask for it that we are doing it for the medical purpose, we are doing it for you for the betterment of your treatment. That's why we are making it as a case presentation. Unless and until patient will say yes, you cannot even give the presentation. Even if you want to send it to your any supervisor, any type of other head, still you require the consent for the patient. So all of these will require the consent. Now we have a question that an 18-year-old Australian girl with lower abdominal pain and fishy vaginal discharge for last 3 days. You are the male only doctor and a female nurse is on duty at the clinic as well. Patient prefers to have vaginal and speculum examination to be done by a female doctor and declines you to be examined by you. So what you will do in this situation? Now you guys just write it down your answers. Also make sure that this person is already having a chaperone as well. The doctor is male, but the person is having a chaperone as well. Those who just took this course and having a first class with me, I want you guys to be very attentive to be solve the questions with me. So it will help you just clear your concept. Okay. So lots of people give the answer, but 50% are wrong and 50% give the right answer. So in this question, again, why you are convincing the patient? My question is, as I told you, that 18 years old girl is legally allowed to give the consent, right? Again, it's a male doctor, still the female is with you, but you have a classical option for you that you can defer the examination because she don't want it, and you can tell you the risk as well. AMC will never give you the time, but we have to take other students as well. We cannot go just directly because lots of students will think and will answer the question, right? So we need to take every student with us. So in this question, you cannot force anybody in Australia for any type of thing. You can counsel it, but you cannot force it. So D will be the right answer, that you have to defer the examination and inform the patient about the associated risk of not doing it. Although the chaperone was there, but still, if the girl is not wanting it, she can tell you that doctor was did something wrong with me. Despite I just tell that I don't want the examination. The breast examination, genitalia examination, rectal analysis examination, these are the sensitive areas. If somebody is not giving consent, you cannot force anybody. So better you have to tell them, just defer the examination, and you need to tell the benefit and the risk of not doing it. That once if you are just getting any type of STD, I am not the one who is responsible because the examination was not done. And you will be write it down on your prescription paper as well. So in this way, you have to save yourself. The first responsibility is, yeah, that you have to save yourself. I am removing it and somebody is still having a phone Infinity X is marking it down. So please do not do this thing. It's a request. So this is the question. Okay. Now the question comes that what is the decision making capacity? Very important thing. Are you able to take the decision or not? The question is, one is, what is the capacity? Maybe you are 70-year-old and you are in a delirious state and you are giving the wrong consent. The first thing is you need to see the decision making capacity. Maybe you are 19-year-old but you are having the mental retardation MR, or you are having the ID, intellectual disability. This is the foremost thing, to just see it. Whenever you are solving a question and there is a question regarding any type of decision making capacity, any type of consenting who is a old age, just make sure that you have to assess the mental capacity. Are you able to understand what I am telling you? Are you able to understand that this is having the consequences? A person come to you and ask you that just do my hysterectomy, and she is 21-year old and is not married and not even having any child. You cannot do it just because the person is asking for the hysterectomy. You need to tell everything. You need to tell the consequences. You need to tell the thing that whatever the post consequences, all will come in the decision making capacity. If somebody is telling you that if I am in the verge of dying, just remove my ventilator. Just see that this person is okay or in the delirious state. Decision making capacity is very important when you are solving the ethics question. Reasoning about the treatment, that are you able to accept this treatment or not? Are you able to understand what are the consequences? If somebody you are giving the chemotherapy, I don't know that you will having the alopecia, you are having the lung fibrosis. This is what the reasoning about the treatment, appreciation, the situation, consequences, understanding, and communication. And once the question arising, if the person is not having a decision making capacity, then who will decide the patient's decision? Now, patients legally able to consent, adult, age 16 years of age or over, are presumed to be legally competent to give consent, a presumption that can be rebutted by evidence that shows a lack of competence. A higher level understanding is required for more complex or risky procedure. 18 will be the landmark, but you will be see that there is a Gleek competency. And what is the Gleek competency? And in Gleek competency, what age will be required to just consent for the any type of procedure? Now, what is the substitute decision makers? And who are the substitute decision makers? For example, your decision making capacity is not able right now, then who can make your decision in on beside of you? So in clinical practice, particularly in hospital and other situations or institutions that are care for elderly, doctors are frequently faced with patients who are temporarily or permanently lacking the capacity to give their consent for treatment procedure. As I told you that in old age, UTI is very common. Due to UTI, a person can go in delirium and cannot be able to give consent. An old age person will be facing the dementia. It can be from the Alzheimer disease, it can be from the frontotemporal dementia, or it can be due to the ischemic dementia. Just because of dementia, a person's capacity is not working, or there will be a frontal lobe tumor, that's the making decision capacity will not be working, or there will be a frontal lobe ischemia that you just forget everything. You forget what is right and wrong, what is good for you. The old age thing will be very important and facing more likely this. Also, there will be a old age homes. So for their treatment, the consent will be very necessary. So on their behalf, who will be give the consent? Now, medical decisions in these situations are sometimes made after consulting relatives or cares. When a patient is incompetent to give consent, the doctor should first seek to establish whether the patient has signed the advance care directive or if there is already a guardian appointed who is authorized to make medical decisions on behalf of the patient. Now, what is advance care directive? This terminology you will be listening again and again. For example, you have made a will. In this will, you say, whenever I was dying, whenever I just forget everything, whatever the decision will be take for me will be my wife. So, wife will be the advance care directive. Whenever you are lost the decision making capacity, or you lost anything, or you don't want to live it, who will be the one who take the decision on your behalf? Will be your wife. Or I say that I don't believe my wife, or I just don't have trust issues with my son. If I have something, or I will die, or I want to give my money, I will make the advance care directive to my GP. General practitioner can become an advanced care directive in Australia because in Australia there is not a family type of system. Most of the people are living alone, so they can make their advanced care directive to their GP. That Dr. Sean will be my advanced care directive on behalf of me once I was not having capacity to take any decision. So everybody will call the Dr. Sean to come and take the decision on the behalf of this person. Getting my point that what is advanced care directive? So in neither in the case, other than the minor treatment, the guardianship legislation must be followed. For example, you made your son your advanced care directive, but your son died before you, and now you are on the verge that you cannot take the decision. And there is your wife and there is your daughter who is fighting over the thing that wife want you to be live on the ventilator, but the daughter want you to end your life. And son have the advanced care directive, and son has died. Now the daughter and wife was just fighting on this behalf. Both don't have any type of advanced care directive. What you will do in this situation? Then you will take this matter to the court, either legislature court, either family court, either high court, any type of court. You will take this matter to the court. Getting my point? Shall we move to the next? Now the legislation identifies a hierarchy of person responsible. We make a hierarchy, right? Dr. Imran Munir, please stop putting this dot so other person can see it. Yes, similarly, this type of situation you will see in the BCQs because these are when somebody is on the ventilator, You will follow the whatever the better is over there, but there will be a proper legal written thing, you have to follow it. Because ventilator, a person on the verge, it's an emergency, it's not a normal situation. And there will be not type of court like you will go one day and they will be hearing after 1 month. It is not like that. So the most detailed hierarchy we have to follow it is that patient have the advanced care directive or not, someone appointed by the patient or guardianship court as the power of attorney or legal guardianship, the patient's spouse or domestic partner, next of kin. Like first we will start, if I am a male, I will give my advanced care directive to my wife. If she's not available, I will give to my elder, we can say daughter or son. If it is not available, then patient nearest relative over the age of 18, or any type of granddaughter, son, mother, father, any type of nephew, uncle, aunt. If they are not available, then the neighbor, any carer like nurse, teacher, or friend. Anyone you can give the advanced care directive to the person. If you don't have any wife, give it to your son. Don't have any son, give it to your daughter. Don't have any daughter, give it to your any type of grandparents, any type of relative. If you don't have anyone, give it to your neighbor. If you don't have a neighbor, give your friend, teacher, even your general practitioner, that is the GP in Australia, can become your advanced care directive as well. If anybody wasn't available, then application will be going to the guardianship court or a public guardianship or the public advocate. Then they can make the decision on the behalf of them. And when you require the guardianship board, you will require when two parties are conflicting. Mother and sister are conflicting. Advanced care directive was not given to anybody. So this is the question that you are a junior medical officer in a hospital where you are looking after a 78-year-old male patient who has been having a progressive decline in his cognitive function due to Alzheimer's disease. He is scheduled to undergo an elective sonography next week. However, last night he was admitted via ED after suffering an acute stroke. His wife passed away 2 years ago and he has not appointed a power of attorney since. The son was called to the hospital to discuss the patient's serious condition, where he was informed that his father most likely won't recover and is currently only on supportive measures. The son, however, insists that the doctor must try everything possible to save him. So, in such scenario, what should we to do next? Okay, if you guys are going with the option D, then why you are going with the option D? This question they are giving in the exam again and again. This is the recall from the exam. Variable answers. Okay, you guys are giving a variable answer. So one thing is that you see the question again, you are a JMO. This is the first job you can get in any hospital as a JMO, right? You see the age of the patient, that is the 78-year-old. That means the old patient. Also a known patient of the Alzheimer's disease. It means the cognitive level is still on the progressively decline. That means there is no capacity to give the decision. He is going for the electric cardiography next week, right? So last night he get the stroke. His wife passed away who hold the power of eternity, right? Now, wife pass away. So this is a similar case what I was telling you before. Once the wife pass away and wife has the power of eternity, son cannot do anything. But son is trying to having a fight or having a hot type of argument with the hospital. Hospital people are saying that there is no chances of any recovery, but son still wants to put on the supportive measures, right? Two thing what is over here is, one is son don't have any type of power eternity, so he cannot make any decision on the behalf of their father. This is the first thing. Wife have the power of paternity, wife already died, and wife didn't even transfer the power of paternity to anyone before she died. Now hospital is telling the son everything, because old age and you are using the hospital resources, and these resources can be used by the other person. Maybe he will be a young and he will get saved the life. Hospital can never be waste their resources. So once there is a type of clash, hospital want to save their resources because they know there is a no consequence, but still son have a type of hope that my father will be get better. This is a type of a clash. Once you are having any type of argument or clash, the matter is directly go to the court. If over here will be son having the power of attorney, then you have to follow whatever the son is saying. But the power of attorney was held by the wife, and wife died. Now you have to follow, bring this matter to the terminal court. We will follow the hierarchy once anybody will transfer it. Hierarchy means is that if I don't have my wife, I will give it to my son. If I don't have means it is not exist in my life. But if your wife exists in your life and you have given to your wife, then your my wife must have to transfer to anybody before the wife will be die. It is not like that it is automatically transferred to anybody. This system is not working like that, because it's not only for the health. Power of attorney can be for the wealth as well. You have so much money or something. Yeah, if the wife can transfer it to the son, then the son, whatever you have to follow, the whatever the son will say. But the son don't have any power of attorney right now. Getting my point? So far so good, that how the power of attorney will be work and how this thing will be working, right? Okay. So your tip, working out an alternative so long is the best option for the concern, perhaps better than having to go through the legal process for appointing a guardian or the financial management. Meditation is preferred over guardianship application. This is for the tips. Now you have another question, that you are working a GP in a rural town. You have a good relationship with the family of Mr. Jones as a primary care provider. Mr. Jones visit you to discuss advanced care planning. She requests you to sign her will as a witness. So what you will do next? Dr. D was the right answer, that you will take the matter to the guardianship court. Yes, doctors. I see a variable option over here. And most of you give the right answer. Very good. So I guess most of you get the question. So here what is happening? Why everybody is asking for she needs to see a lawyer? Why? There was a question that you are a GP in their rural town, right? And you have a good relationship with the family of Mr. Jones as a care provider. Mr. Jones visits you to discuss advanced care planning. Like he is coming to himself, he is not sending anyone. And she requests you to sign her will as a witness. What I told you that a GP can become an advanced care directive. This is a very simple question. I told you the nurse, a teacher, a neighbor can become your advanced care directive. See the question again. Mr. Jones come by himself. If she's sending her brother or someone else and asks you to just sign the will, then you will say no because somebody else is coming on their behalf. But you are a working GP, you are having a good relationship, you can become an advanced care directive. What's the problem in that? Getting my point? You can become an advanced care directive, you can sign her will as well. But if in their question there will be a brother will be coming on the Mrs. Jones behalf, then you will be not signing the will, because how you can know that Mrs. Jones can change the will or not, or why the brother is coming. Now see the another question after that. So substitute decision maker. So when there are two relatives in the same position, for example a brother and sister, the elder will be responsible. Like your sister will be 18 and your brother will be 17. Despite your brother, you are having the brother, but still your sister will be elder and 18. Your sister will be responsible. So when a relative or carer accept the role of a person responsible, there are obligations and restrictions. Decision must be made in the best interest of the patient, and effort must be made to determine the wish of the patient and patient's family. For example, there is a 80 years of female who is having a stroke. After a stroke, she is talking irrelevantly. She is saying that today is a Thursday, despite today is a Monday. This is the irrelevant talk. She is saying that you are not my daughter, despite she is your daughter. This is the irrelevant talk. That means that that female don't have any decision making capacity, right? Hospital wants that if we do any type of give medications, she will be all right. But the daughter said that my mother gave me the power of attorney. I don't want my mother to be continue any type of treatment. Now this is the matter of conflict, because doctors know that mother will be all right once she will be giving some medication, but daughter will be saying that I am having power of attorney and I don't want to save my mother. Once this type of conflict will become, you need to take the matter to the court, because here the hospital is in the interest of getting the best decision for the patient. Hospital is taking the best interest for the patient, but you are trying to let the mother die. Whenever there is a best interest will come, even you are having holding the power of attorney and you are having a interest of conflict, that matter will also go into the court. Why? Because hospital are thinking about the best interest for the patient. Hospital people know, doctor know that if she get the treatment, she will be alive. But you want your mother to die. Maybe you want to get all the property. So despite of having a power of attorney, if you are thinking bad for the patient and hospital know the best of interest for the patient, this matter still into the go into the court. So this is what ethics will be very difficult for a person. If there is a matter of conflict between a son and a daughter, but a daughter hold the power of attorney, still the power will go to the power of attorney. But if there is a conflict between us hospital person and to any type of family person or holding a power entity, then what is the best of interest if hospital is doing it? So we will bring the matter to the court, because we need to see that despite of best interest will save the person. What will be the despite of having a power identity, why you are taking your mother to the deathbed? Power identity is the main thing, but what's the patient's best interest will be, that's why I highlighted it on the way, will become first. So in addition, a person responsible cannot consent to a special procedure like lead to the infertility, termination of pregnancy, removal of tissue for transplant. The person responsible must apply to the Victorian court or any type of legislation or court must authorize. For example, you are having a baby, but your husband wants you to terminate the pregnancy. A person or husband, a boyfriend cannot even give the consent for the termination of pregnancy. Despite this is the mutual decision for getting the pregnancy. You are having an MR or intellectual disability. MR means mental retardation, intellectual disability will be the ID. And still you get the pregnant, but your mother say, I cannot take over you, I cannot care you for the rest of my life. Please do the make my daughter remove her ovaries and uterus. Despite you are a person who is mentally retarded, but you are having authority to say no. And if you are saying no and your mother will be on the verge, because mother is your caretaker, because you are mentally retarded, and she said that I want to remove the ovaries and everything, so this type of matter must be taken the court. These type of procedures, your consent will be matter more, your decision will be matter more. If there is a conflict between you and your mother or your any type of caretaker or caregiver, the matter must be going to the court. Getting my point? Now you have another question. 75-year-old male is brought to the hospital with a reduced level of consciousness. CT scan of the head show epidural hematoma, which requires non-urgent surgery. You are unable to discuss the procedure with the patient due to decreased level of consciousness. His spouse and the eldest son are present at the scene. His wife says that her husband never wanted to come to the hospital and would never wanted to be rescued or any surgery on him. His son requests you to do everything possible to save his father's life. So what you will do in this situation? Remember one thing, when you are solving this type of question, three things in your mind. Follow the hierarchy. Who will come for the person? Son will be the one or the spouse will be the one. One, you need to follow the hierarchy. Second, you need to see who is having the advanced care directive. Third, you will see what will be the consequences before answering this question. Not every time they will mention that the person is having advanced care directive. So it is, if there is nothing mentioned about the advanced care directive, you need to see the hierarchy. Doctor, power of paternity will having a lots of benefit. For example, if you are on the deathbed and you are no longer want to, for example, you are into the coma, and hospital will say that you can be put your patient on ventilator for the rest of 400 days or 500 days, and maybe she will improve someday. But you are having power of paternity and you say, no, he said once I was on the verge of dying, just let me die, or just remove my ventilator, or I don't want to live. If the hospital will see that there is any chance of having any type of recovery, they will mention the question. But you are having power paternity and you see there is no chance of recovery, they will on go for you. Matter of conflict will be go on the thing when the chances of living will be 100%, but despite of having a power paternity, you are making the benefit of it, right? For example, 17-year-old boy, he say, mother say that I am having power of eternity. Doctor say I can save the life 100%. But you say, no, my son said whenever I just get an accident, just let me die. Now you are taking the benefit of that power of eternity. Any power of eternity doesn't mean that you can use it in a wrong way. Power of eternity is for that whenever there is a verge of no consequences, there is nobody to take the decision of that thing. There is some medical condition where you are just conflicting and there is no improvement at all, then the power of eternity will be best play over there. But getting the benefit or the wrong benefit from power of eternity, it is not for that. This type of thing will be come to the matter of interest or matter of conflict. That type of matter will go into the court. Now when there is nothing mentioned about the power of eternity, then you have to follow the hierarchy. In this situation, you need to listen to the spouse. The answer is you need to listen to the spouse. Because as I told you, in every question, there is nothing mentioned about the hierarchy. So you need to go to follow the hierarchy. Nothing mentioned about the power of eternity, so go to the hierarchy. Spouse will come first and then come to the any type of eldest son or daughter. If the spouse was died, nothing mentioned about the advanced care directive, then you have to follow the eldest son. In this question, a person is not able to answer anything because he is not in the conscious level. Spouse is present. Spouse says that my husband said at some time this was the thing, you need to follow it. But the son is saying the opposite thing. So the hierarchy is present. So what you need to do is you need to follow the spouse. Now another question. 94-year-old woman come to your clinic for follow-up. She had a fecal occult blood testing which is positive. You have recommended her to have a colonoscopy as the most appropriate next step in her management. However, she refuses to go ahead with that and informs you that she would rather not worry about that. It seems she understands the risk as well. This is the important line. Her daughter, who is also present in this consultation room, requests you to organize colonoscopy for her mother. Her past medical history included type 2 diabetes and chronic obstructive disease. So, what you will do next? Very good. Most of you give the right answer. Why? Because as I told you that it seems she understands the risk. That means she is compatible to give the decision. Once the person is compatible to give the decision, whatever the decision she is giving, you need to follow it. So you need to listen the patient and respect her wish. Despite you have told everything regarding your type 2 diabetes, COPD, she is even fecal cord blood testing is positive. Despite if she is deferring the colonoscopy and having a mental capacity in a sane position, you need to respect her wish. Now, getting my point, these type of questions are very tricky. It will come, it will because it's a first session. You will be having a master on these questions when you practice again and again. These type of question they will give you with a different scenario. Sometimes they will mention you the power of fraternity, sometimes they will never mention it, sometimes they check the hierarchy that are you able to know the hierarchy, sometimes they will check the power of fraternity, sometimes they will give you the matter of conflict and check you that are you able to transfer it to the code or not. So this is what 3 or 4 type of similar question that is coming in last 10 years of the paper. They will change the twist the question, but the topic will remain the same. They will change the conflict. The conflict will become on the ventilator side, they come on the any type of accidental cases, come on the splenectomy, come off any time of removal of kidney. They will change the situation. They can change a person or they can change any type of thing, but the topic will remain the same. If they want to ask a question, they can ask the question from the advanced care directive. If they want to ask the question, they can remove the advanced care directive and see that are you able to know the hierarchy. Sometimes they will not give you the spouse, sometimes they will give you the two son are available. One is 21-year-old and there is a daughter as well, because most of the people sometimes they do the reverse. They say 19 years old daughter, 17-year-old son, just because everybody will give the importance to the son. They will never see the age of the patients, that the daughter is 19-year-old, so the hierarchy will go to the eldest one. By changing a minor twist to the question, they change the whole scenario. This is what they do in AMC. So, treatment without consent. So, emergencies, when the patient is unable to consent, the patient is temporarily incapable of giving consent. The immediate treatment is required to save the patient's life or prevent serious damage to their health care, and there is no substitute decision maker immediately available. These questions come again and again in the exam. When the person come to you, appendectomy or a burst abdomen, and there is nobody to hear, who will give the consent? You will see there is a question as well. So as soon as the patient's condition is in sufficient proof or stabilized, consent for ongoing treatment must be obtained. For example, there was a patient come to you for the burst abdomen. Just because there was nobody, consent was given by the authority and you have operated the patient. Now patient is on the ICU. As soon as on the second day, the family arrived from nowhere or somewhere the family arrived. Still on the second day, despite you have done the appendectomy, despite you have done the surgery for the laparotomy, you need to take the consent even after you have done the surgery as well, because ongoing treatment you require the consent, because there will be a stay for 3 days for the ICU, then HTU, then step down unit. You require the consent for these days as well. Now, emergency treatment is covered by the consent to the medical treatment and palliative care. The legislation calls for second doctor to personally examine the patient and provide written support for the treatment plan unless such a second opinion is not practicable. For example, I am not reachable to you. You are my son, and you just came to the OR with the appendectomy or some type of burst abdomen. I am available on telephonic type of any telepathy or something like that. But you are the only doctor. Maybe I will say another day that I did not give any type of consent on the telephone. You are lying. When you are taking a telepathic type of interview or you are taking any telepathic type of consent, two doctor must be available at that moment. So both the doctors have listened that you have consent for this patient. Getting my point? Because mother can say, I just said no to the doctor, but doctor have done by themselves. When there is a two person, a mother cannot be denied by the decision. So when there is a telepathy type of consent, two doctors, two nurses, registrar, whatever the type of terminology they have used, it will be required for the consent. Now, 24-year-old male presented to your office for evaluation. He was bitten by another person in a cafe at night. The infectious status of the victim is unknown. You have ordered blood tests for HIV, HC, and hepatitis B. However, the patient declined to be tested for hepatitis C and HIV. However, is happy to test it for hepatitis B. You are contacted by the GP of the other person next morning. The GP wanted to know if you have requested the blood test to check for blood-borne diseases. The victim is unwilling to give consent for testing hepatitis C and HIV. So, what you will do in this situation? This question come in the last week of exam as well. Every time this question come in the exam, and every time everybody get confused. Remember one thing: if somebody who is getting confused in the questions, AMC will give this type of question again and again in the exam until the 50% or 70% people will get to right answer of that question. You will see once you will open the Q bank of the med exam expert, you will see there was a question from the horse riding. That a person who was horse riding was fell down from the horse and get the nasal bone fracture. And what you will do next? There will be lots of options that put on the ventilator, pass the nasal tube, pass the oxygen, give the antibiotic. That question is come again and again coming in the exam. Doctor, why you are going for the E? You are already counsel the other person and he is not willing. Because once you are asking for it, you are also asked for the pre-counseling as well to do the test, but still he is not willing. And once somebody is not willing, you have to respect for its wish. So you cannot ask the victim to just ask the other person as well. So you need to respect his wish. What's the other option that is available for you? Yes, very good. You need to ask the GP to treat the bite prophylactically, because you need to respect the other person's wish, and you need to also save yourself from the hepatitis C or HIV as well. And you are, and because the person was not happy to go with the status, so you are on the risk of getting the infection. So better to treat it prophylactically, because if the post procedure of 72 hours will be gone, you will be welcome to the HIV happily. So what is better for you? Just ask the GP to treat the bite prophylactically, because the other person is not happy, not giving the consent to test it for the hepatitis C and HIV. So better to treat it prophylactically, respect the other person's wish, and save yourself. This is the both way to be happy. Another way, you don't even ask for the patient and also not getting the infection as well, because you are treating yourself prophylactically. So not getting any type of infection. Now, non-urgent but necessary treatment in incompetent patient. So what do you mean by the incompetent patient? Anybody? Who will come in this category of incompetent? What do you mean by that incompetent? Alzheimer, okay. Other? Unconscious, very good. Delirious? Yes. Also, patient who are the age of 12, 11, having MR, having Down syndrome, having intellectual disability, any from any type of accident, they are not capable of doing any consent, any frontal lobe deformity. Why I am just taking name of these things? Because in the exam they don't say that this person is not having any capability. Okay, remember one thing, in dementia patient we will do the test. We will see the level where it lies: mild dementia, moderate dementia, or severe dementia. We will do the cognitive test, and on cognitive test, even 20% patient will be able having a better the normal system of the brain. 80% they have the problem in the recent memory recall. 90% of the old or the past things they have remember very clearly. Yes, there are lots of things, MSc, MMSc, lots of things. We will do the cognitive testing. We will do the frontal lobe testing. We will do the temporal lobe testing. There's a each lobe testing exam as well. Incompatible patient means they will use in the terminology Down syndrome person. They will use the terminology a person previously having a frontal lobe ischemia. Frontal lobe ischemia means your decision making capacity loss, your personality changes will become first, you will be disinhibited, lots of things will be come out. So sometimes they mention this type of terminologies as well, or they will mention that the previously she is having stroke, or there is a family history of dementia. They mention this type of terminologies in the exam. So that means they are talking about the incompetent patient. Getting my point? So minor treatment is any treatment that is neither major or nor special. Minor treatment will come like a eye surgery, like any type of scratch wound. These come will be the minor one. Any type of pus drainage, this come in the minor one. The guardianship legislation identifies example of minor treatment, non-intrusive physical examination, first aid, administration of usual medication, treatment that is not major or special or part of any clinical trial. So, minor treatment also include a general anesthesia for the management of fracture of for or any type of endoscopy and single use of certain prescription drugs. Now, this is important. Influenza vaccination in the nursing home. One 82-year-old man with severe dementia does not want to be vaccinated. Lock himself in a bathroom. What should you do? Remember one thing, this type of question in which the answer was written on the upside, these are the recall. What I gather for you guys to see what is previously in the previous month of November, in October, these are the questions come. And recalls are very breaky, like this. And the questions you are seeing in this form, this is from the RSCGP guideline, what Royal College give us. So I am exposing you two type of questions. One, what is from the question bank, what is the Royal College of Australia will follow the guideline. This is from that question. And this type of question are those what is come in the exam. So that's why these are very breaky. These are very incomplete question because this is what human tell us. This is come in the last month, right? So 90% answers that is written on the upheading will be the right, and the 10% will be the having some shaky. That's why I want you to clear your beliefs, to clear your concepts. So in this way, you get the exposure of both questions from the Royal College of Guideline as well and from the past recall as well. In the exam, the question from the typically clear will have very 4 to 5 of lines of stamp. Getting my point? So in this way, you will see that how the question come in the exam and how the Royal College will give us the guideline to solve the question. Okay, why you guys are doing go for the fourth and doing nothing? Maybe he will be die from the influenza. Any wild guess? Why you are not even asking for him or forcing him something? He is having severe dementia. Maybe the cognitive function is not working. Why you guys are going for the do nothing? As I told you, it's a recall. The best option over here is check the mental capacity of a patient because it's a recall. Maybe the recaller is remember what he just typed it down on the exam. The best option over here is check the mental capacity because it is mentioned in the question severe dementia. So the first and foremost thing is check the mental capacity of the patient. If this type of their statement is not in the option, then respect the patient wish. Why? Because there is a type of people, Aboriginal, who cannot vaccinate their child. So we cannot force anybody. But for this type of patient, when there is a big statement, write it down on the exam. Severe dementia means to first check the mental capacity. If it is written in the question that a mental capacity seems like a perfect for me, then the answer will be do nothing. Doctor, you want to see this slide? All good. Shall we move to the next? So first, for in this question, you need to check the mental capacity of a patient. Next will be if they say mental capacity is perfectly fine, or if they say that seems like a mental capacity is normal, then you have to respect the patient's wish. But whenever there is a big stem like severe dementia, this is the main thing that you have to check the cognitive decline. Because sometime AMC love to ask, what should you do next? That means what you do the next. They will make you confused that what is the initial thing you will do? What is the best thing you will do? In this type of statement of the last line, AMC will make you confused. Now, the consent and the mentally ill patient. So, when obtaining consent, the diagnosis of a mentally illness does not necessarily preclude the capacity to consent, and the doctor's first action should be to assess the capacity of the given consent. For ECT or psychosurgery, consent must be given by either the patient if insight is present, or it will be given by mental health tribunal. This is a big thing to remember. If there is lack of insight, then use Mental Health Act to hospitalize patient without the consent of a patient. For example, a person come to the hospital, bring up his sister because his sister tried to stab his mother. Sister say, I am all right. Don't want to admit in the patient just because if you don't admit the sister, she will kill the mother. In this way, patient's consent is not required. You are admitting the patient involuntarily under the Mental Health Act to save the life of other patient or to save the life of this patient as well. Because somebody who is taking a knife behind anybody can kill him or herself as well. In this way, the consent of that patient is not required. A person, see, I am who is 14-year-old or who is 21-year-old, one day just say that I am seeing the humans, they are trying to harm me, or they say mother is trying to put poison in my food, and left to eat the food or drink water for the straight 4 days. If you don't admit this patient, he will die. And you bring this patient and they say, no, I don't, doctor, I don't want to admit. But if you don't want to admit this patient, that patient will die. Just because of severe psychosis, he is not eating anything. He is saying that somebody poisoned my food, somebody come to harm me. In this way, which is an acute psychosis and the life is on the stake, you need to give the ECT. Once you give the ECT to that patient, for this ECT, the patient, because in a lots of psychosis, he is not able to give the consent. For this, consent must be taken by the mental health tribunal. Do the ECT and use the mental health tribunal. This type of cases will require no consent. That consent will be given by the Mental Health Act. Insight means, are you know that you are having any disease? For example, I am having schizophrenia and doctor asks me that do you feel like that you are having any type of disease? I will say no doctor, I am very fine. It means I am having lack of insight or the insight is absent. I will say no doctor, I don't have any disease, you are mad. That's why you are in psychiatric hospital. Absent of insight, that I don't know that I am having the disease. This is what we call the insight, that I am having disease but I don't have any insight regarding my disease. But I am coming to the hospital. I am a known case of depression. I am on the tablet sertraline and I am coming to the hospital and doctor say, do you know that you are having a disease? I say, yes, doctor. I am a diagnosed case of depression since 2005 and I am taking tablet sertraline. But right now, I don't want to admit in the hospital. I want to take my medicine at my home. Despite of I am having mental illness, I am a known case of depression, but I am having insight that I am having disease and I don't want to admit. In this situation, they are bound to give me the medication and then admit to just admit, let me go to the home. Despite of admitting into the hospital because I am having insight. Despite I am a mentally ill patient, but my insight is present. and I want to take medicine, but I want to take medicine at my home. So, in this way, my consent is very important. In mentally ill patient, consent will be wiped off or consent will be transferred to mental health once the insight is absent. Getting my point? So far, so good? Or anybody want to ask any question? Yes, doctors. Are you good or you want to ask any question? Shall we move to the next? Okay, those who are my new batch student. Okay, Dr. Amar, that's super fine. I am saying that if a person is know that I am having such type of disease. First, to be clear, there are two types of what I'm talking about. One is I'm talking about the consent, another is I'm talking about the insight. Insight means that I know I am having any type of disease. For example, the doctor asked me that do you have any schizophrenia? Though I am a known case of schizophrenia and taking medicines in 10 years, but I say in front of doctor, no, I don't have any disease and my family is trying to give me medicine forcefully. I am perfectly fine. This means I am having lack of insight. I don't have any type of insight. If I don't have any type of insight, how can I will be give consent to get admitted in the hospital? Doctor, we will allow to go home once if the patient having insight. If the patient in psychosis, psychotic patients sometime don't have any insight. In this way, we need to admit it. For example, a person was stabbing another person outside the home and running behind him and taking a knife on his hand and say, I will kill you, I will kill you. No, for no reason. And also, he don't know the other person as well. That means he is in psychosis. He has something wrong with him. So the first thing is to admit him to the hospital. Because when you take him to the hospital, they will never say that try to admit me, I am having some disease. Even kill myself or kill any other person. What you need to do is involuntarily admit to the hospital. This is the first thing you will do. Because in this way, a person who is running behind someone and having a knife on his hand, do you ask him that do you want to admit him? Are you sure that this person will say that yes, I want to admit it? Definitely no. If the person having this type of insight to that person, why he is taking a knife and running behind someone and try to kill somebody? Because that person's in psychosis. For the psychosis patient, you need to admit somewhere. Getting my point? In this way, the consent was waived off and the consent was going to the Mental Health Act. On this Mental Health Act, you need to admit involuntarily. Similar way, if you want to give somebody electroconvulsive therapy, that is the ECT, if a patient is not giving consent and he is in psychosis, you need to give the ECT on the behalf of Mental Health Act. These will be, I will tell you in all detail in psychiatry. These are new terminologies, and in psychiatry, we will do in detail. Dr. Omar, are you clear with it? Shall we move to the next? Or anybody want to ask this thing again? So far, so good. Shall we move to the next? Okay, so we have a question. During a session, a patient suffering from severe depression, patient revealed plan to psychiatrist to cause his girlfriend serious harm in the coming days. He unfortunately acted upon these plans and murdered his girlfriend. So, which of the following is true regarding the role of psychiatrist in this situation? Yes, doctor. Now, what is the role of psychiatrist in this situation? This question come every month for an exam in a different situation. Sometimes they change the situation that a mother killed the father. Sometimes they change the situation that sister killed the other sister. Yes, doctors.
What is the answer of this question? Ethics will be training. I know these are the very new thing for you guys, but trust me, this is the first lecture. In second lecture, you will be able to answer the questions. And even if there is a wrong answer in your mind, just answer it. Because once you start participating in the lecture, it will make your interest more. Ethics is dry, but ethics is really interesting. These are the new things. Once you practice this question, these slides again, once the topic will be complete, it will be very easy for you. So don't get panic. That's why I start with always with a difficult subject. So once you just getting it, it will be very easy for you guys. Okay. So are you guys with me with the answer number 5? Okay, correct. One thing is that once the patient who is a psychiatrically ill, either having depression, either having schizophrenia, either having bipolar disorder, either having any type of substance used disorder, in which substance means ice addict, any type of cocaine addict, heroin addict, any type of substance addict, alcohol addict, is coming to you and revealing the plans to you, what your duty is. Being a psychiatrist, your first duty is to tell the person who is in danger, so she or he will be alert. For example, if a person come to you say I will kill my mother, so your duty as a psychiatrist is to tell that patient or tell the mother of the patient that your son will be kill you, he is having intention to kill you. And the other step is that admit the patient involuntarily, because if the patient is homicidal, if the patient is suicidal, this is the first criteria to admit the patient involuntarily in the hospital. If I tell you that I will kill myself, if I tell you that I will kill this person and you let me go to the home, this is your negligence. Your license must be cancelled, because just because of you put the life of danger of the person or the other person as well, because that person tells his plan to you. So your responsibility is, if he is homicidal, that he say that I will kill my brother, first tell his brother and then admit this patient to the hospital under the Mental Health Act. This is your responsibility to admit the patient. Getting my point? So in this way, the psychiatric make a negligent act, because this is a real life scenario. This is that's why AMC always give that there was a psychiatrist and there was a schizophrenic patient. He was on remission. Remission means when you are getting the treatment of any type of disease, but you are in a stable condition. So that's why the patient was living in the home. But out of nowhere, he said to the doctor, because schizophrenic have a talk irrelevantly a lot. So he tell the doctor that I will kill a girl I love. So just doctor being in the out of curiosity, doctors was like that maybe he is hallucinating, or maybe this is a bizarre thought of that person, or maybe this is what he will just say it but never will do it. In the next session, that patient come to the doctor and tell that I kill my girlfriend with the knife. And once this matter went go to the court, just because that person was in psychosis when he killed his girlfriend, so that person didn't get any type of punishment, but the doctor was sued. The doctor's license was cancelled, because it was the doctor's negligence that he tell the plans to the doctor, but doctor didn't take any action. Doctor didn't inform the girl, didn't admit the patient. So this is the real case scenario. That's why they are keep giving in the exam. Getting my point? Now 60-year-old woman was put in by her husband to the ED saying that she has not eaten for weeks because she believed that aliens have taken her bowel. After stabilizing the patient, the husband tell you that they don't live together. That means they are separated. During psychiatric assessment, it is proposed ECD, but the patient refuses to it. Like you propose the ECD, but patient say I don't want ECD. So what is the most appropriate thing to do? Yes, doctors. Okay, why we are contacting the mental health terminal and why we are not even obtaining for the patient's consent? Any explanation? I told just away. Why we are not going with the patient because patient already refused it. Why we are not going with the patient's will? Why we are contacting the mental health terminal? Very good, Dr. Steve. Very good. This is what I just want with you guys that at least a 10% can be absorbed from this lecture will be very beneficial for you. Because patient is not having insight, she is having a bizarre delusion. What is bizarre delusion? The thing that is not even possible in a real. Nobody's bowel can be taken by alien. This is a bizarre delusion. So when you are having the bizarre delusion, you are not having any type of insight. Husband is not taking any responsibility. Why? Because they have been separated just because of the lady's psychosis. Now the lady is alone. Husband already said that I don't live together. That means husband is out of this case. So in this way, Haikri will not be follow. Husband is out just because they are not living together. So he's not taking responsibility. You see that patient is already having loss of insight. So the all the responsibility will go to the mental health terminal, and as soon as you need to deliver the ECT because she's not eating anything and she's already 60-year-old, she can be going to the delivery state, she can go into the AKI just because she's not eating anything, she can be going to the electrolyte imbalance, she can go into the tachyarrhythmia as well because of the hypokalemia. Anything can be happen to her just because she's not eating or drinking anything. Giving ECT will be quickly settle down the psychosis along with the antipsychotic medication. So all will be giving for the mental health terminal. Even if they are living together, the husband will take responsibility because husband know the patient is having psychosis. When you guys are living together, that will be a very dangerous thing for you. Living with a psychiatric person is like living with 100 persons together in a home. It's not easy. Even they are not living together, still you see it is written already in the stamp. She was bought by her husband because somebody will tell him that your ex-wife or something was not in a state of right now doing this thing or that thing. Even it is a courtesy that he has been shown that he was bought by the husband. As I told you that even the mental patient can give consent, but when there is no insight, still we need to take the consent because it's our right, where we need to see that either the patient is willing to take the treatment or not. But what we will do, what is the best interest for the patient? Because as I told you, even in the schizophrenic patient, when the patient was taking treatment, there was an insight present. Still the option will be same, desperate of giving, because if the husband was living together or not, why husband bring to the hospital? Husband bring the hospital the lady to just take care of the lady. So what's the purpose of not living? Is it possible that husband can take the person to the hospital? Husband can take the patient to the hospital and then says, I don't want the treatment. So what's the purpose of bringing to the hospital? Husband take the hospital. Reason that she take the hospital to take care of the lady. That's why she take the hospital. If she don't want or the husband don't want any treatment, then why the husband will take the person to the hospital? Getting my point? When there is no insight, despite the patient not giving consent, you need to give the ECT. Getting my point? If they are living together, the purpose of husband to take the patient to the hospital is that to get the treatment done as soon as possible. So what's the point when you are saying no to the treatment and you are bringing the patient to the hospital? Then there is nothing to be taking to the hospital to the patient. Getting my point? So that reason is that when there is, despite of having no insight, we need to still ask for the patient's consent. If there is no insight, we ask it, patients deny, but we will do what is the best interest for the patient, and the best interest will be the ECT. Because if we don't do it, she will be die just because of this bizarre delusion that somebody is taking my bowel. One thing is that they already mentioned it, they are not living together. So husband is not interested in any type of consent. This is a big statement, it is already written over here. Another thing is that, as I told you, ECT, infertility, these are the matter a person can give the consent by himself. These are the matter of the very sensitive matter because ECT is not a normal procedure. You are giving an electric shock to somebody. It's not an easy. You are generating the fits in a patient. In a healthy patient, you are generating the fits. This is what ECT do. These are the thing that will be given. Consent must be given by the person himself or herself. If he is not in a state of mind, then the mental health act will take the responsibility. This is for only the person who is having a mental health type of disease like schizophrenia, bipolar disorder, any type of depression, any type of psychosis. This is a special mental health that is formed for this type of patients. Because most of the patients who are mentally ill, the people who are living with them, either mother, father, they will left them in a mental hospital and never see them. So the mental health act was made for that patient. 90% people who are having the mental disease, the people will left them. In Pakistan, because I am a psychiatrist, I know in Pakistan there's a foundation that is called ED centers. 90% people will left their people to the ED centers. Despite of having seven brothers, eight brothers, they left their sister just because they're having schizophrenia. So they cannot take care of them. They left them to the ED centers. And in overseas, like in Australia or something, they will left them in the old age homes. So where the patient cannot give the consent, who will then give the consent? Then the mental health terminal will come in form. This is made for themselves. That if they are not able to give the consent, then the mental health will take the responsibility and they can do what is the best interest of them. Because family cannot want to live with a mental person. Even the family will be very rich, they don't want to live with any type of mental illness patient because it's very hard to be keep them to be a caregiver or to be a caregiver to that patient. So the mental health act was formed for this type of people. So they will be consent on the behalf of them. Getting my point? I think this is very clear for you. If it is not clear to you, you can ask me. I can tell it again in a different way. Or shall we move to the next question? We already asked the patient, but patient already denies. It is already mentioned in the question. So that's why we are not taking from the patient. It is already mentioned, right? Next question. Okay. So a 25-year-old male has been admitted to mental health ward under involuntary treatment or treatment order for psychosis. Now, on physical examination, he is found to have 5 by 5 centimeter ulcer on his plantar surface. Uh, Plantar surface of the left foot. Debridement and wound wash are required along with IV antibiotics as the initial step to treat this wound. So, how will you proceed regarding the consent? Two things over here. He is a very young patient, 25-year-old. Also, they say they admit him involuntarily for the treatment of psychosis, right? Now, they on the physical examination, they say this person is having a ulcer on the foot. Now they want debridement and wound wash and also want the IV antibiotics. So how they will take the consent? Doctor, before going to E, what is the first step to take the consent? Doctor, previously the answer was to do the ECT and take the Mental Health Terminal Act. Yes, the first and foremost thing is you need to take the consent from patient. As I told you that even in the psychosis, your first duty is to take the consent from the patient. What is your first duty? To ask for the consent for the patient because you are doing debridement, you are doing something. So the first thing is you need to tell them. Even in psychosis, it does not mean that a patient is mentally retarded. Mental retardation and psychosis are two different things. In psychosis, not all senses are lost. It depend on it is a severe psychosis or a mild psychosis. Even in the psychosis, a person can save somebody, but a person can want to die for anybody. Have you ever listened or have you ever heard about the postpartum psychosis? In postpartum psychosis, sometime a patient want to kill the baby, but 80% time when you just try to separate the baby from mother, she will always ask that my baby is good. Did somebody give the feed to my baby? Psychosis doesn't mean that a patient has lost all his senses. Getting my point? So first you need to take the consent from the patient, even if there's a surgical procedure, even if there's any cataract problem. And then if you say that a patient is not even was okay with that, you need to respect the patient's wish. But you see, if there is a matter of life and death, like if you see if this operation was not done, for example, if a burst abdomen cannot be treated and patient will be die on the spot, then you will not go for the patient's wish. Then you will ultimately go for the mental health terminal. Yes, even in psychosis, need to ask for the patient consent because even the psychotic patient was can be treated by a normal patient. Because being a psychiatrist, we see the psychiatric patient is like a normal patient, right? Yes, in life-threatening condition, because if the life-threatening condition and patient saying that no, I don't want to give consent, it means the insight was nearly poor because there's a level you will see in the psychiatry that there's a level of insight. Mild insight, moderate insight, lack of insight, or absent insight. Maybe the person have insight in this way. No, I will be fine. Maybe a person having no insight that he is standing on a tall building and want to jump from that. So insight having a levels. So these are for the picky tips for it. When answering consent questions, always remember the order of who you can consent, starting from the patient themselves. This is what I told to tell you. Everybody was going for the option E, that asking for the consent for mental health. No, always start from the patient, then they follow the hierarchy. So mental health act, that will be form is used to be only where the involuntarily admission is required, when the ECT is required. That's it. Mental health act will not go for the any type of property case or something like that. You will use the mental health act regarding the psychiatric thing. For the ECT, for the involuntarily admission, for the administration of antipsychotic, these are for the mental health act. Yes, of course. Even in minor, the minor child psychiatry will be a very great field and very a vast field. Even the child can go into the psychosis. Okay, so a man with past psychiatric history presented to the court, his lawyer comes to you as his GP for report. So what you will do? Again, these are the questions that is coming previous month or in the October November recall. It is a recall. In the exam, remember the question will be very clear, 4 to 5 stems. But I want to expose you with all type of questions. So you will see that how the question will come in exam. Yes, doctors. Very good. Get a consent from the patient. If not the patient, then the lawyer would need the consent and written consent from the court for or a competent patient. Remember one thing, always start with the patient. Now you are a JMO in a hospital. Okay, this was the previous question that was we have done. Alzheimer one question. Okay, 22-year-old university student present for HIV checkup as she had unsafe sex with her new boyfriend, not known to have HIV 2 days ago. You performed the test and report came back negative. Now, what will be the next step? In the exam, the question will be like this, because these are the practice question what AMC will give you from the Royal College. Variation of answers. I haven't get the name of the people. It is like Samsung, iPhone. So those people you guys give the right answer. You see in the question it is mentioned that it is only 2 days ago. Very good, Dr. Steve. It is only 2 days ago. In 2 days, a report can come back negative because the incubation period is for 6 to 12 weeks. So you need to perform the test again in 12 weeks. This type of question they give again and again regarding the infection disease point of view, regarding the ethical point of view, regarding the medicinal point of view. So this type of question they can give you again and again in the exam. The university student come back to you only 2 days ago. So that's why they came back negative, because there is an incubation period, there's a detection period. Then when it will be detectable in the blood, when it will be detectable in the urine, when it will be detectable on the RNA isomerase, and when it will be detectable in the Western blot test. They have the time periods. That's why we ask them to perform the HIV test within the 12 weeks or after the 12 weeks or from the, or sometime they will mention you 6 to 12 weeks. So this will be the right answer in the exam. Now this is very important topic. That will be the refusal of blood transfusion. Very, very important. One question from every time they will give from there. So, because of the belief of some religious group, doctor not infrequently encounter patients and their families who refuse blood transfusion. As a starting point, the first consideration should be whether there are safe alternative to blood transfusion. Remember one thing, I know we because AMC we are giving the lectures internationally. We have a people from different castes, culture, race, and religions. So we have to respect every religion boundary. But there is only one type of people or religion belief. They are the Jehovah's Witness. They don't accept blood from anybody. Whatever they have their belief, we have to respect their belief. But in the exam they are asking you for the exam point of view, you need to know that which type of people that will refuse the blood transfusion. So they are the Jehovah's Witness. We need to be respectable with them, we need to respect their beliefs. Whatever their beliefs, we need to respect them. But in the exam they will ask you, so for them what the alternatives we will provide them, just because they have the religious belief, so then we need to provide the alternative to them. They are respectable for us as well. Every religion is respectable for us. Remember this thing, okay? So, what is the starting point? They say if they are not they are accepting any type of blood or they are refusing any type of blood, so the first alternative is the alternative to the blood transfusion, like Hemexil, like any type of we are giving ringer or whatever that will be increase the blood pressure. That will be alternative to blood. Getting my point? So the refusal of transfusion by a competent adult must be respected. But what they say, competent adult. Nothing mentioned about the child, nothing mentioned about the infant, nothing mentioned about the neonate. We refusal of transmission we will respect when there is a competent adult. Competent adult means he is in a state of mind to just refuse it. Not in a hypovolemia, not in a delirium, not from the RTA, the patient on the deathbed. If he is refusing it, so check the mental capacity first. Getting my point? Now, where parents refuse life saving blood transfusion for a child, all jurisdiction must have legislation that enable doctors to provide blood transfusion in emergency. If a person who is from a Jehovah's Witness and a baby is 3 year old having any RTA and the parents are refusing to get the blood transfusion and you are in Australia, you are a practicing doctor, your duty is to transfuse the blood because the child will be your responsibility to save the child because child is an innocent 2 year old child cannot give consent by himself or herself. If you don't get transfuse the blood, maybe he or she will die, and you cannot die, let anybody to die. If he or she is not even a person, cannot give the consent, a child. In this situation, blood transfusion in an emergency. Remember this thing, what I am focusing on. That doesn't mean we are not respecting their religion or belief. That means we need to save the life. Saving life is above all the religion or above all the belief. Getting my point? Saving life, even if you are saving a life of a criminal, if you are saving a life of a person who have killed anybody, it means saving a life is above everything. Above religion, above belief, above humanity, above everything, saving a life of anybody. This is what the oath we have taken for to become a doctor. So we cannot let the child to just die. We need to blood transfusion in an emergency. But if it a competent adult, must be respected for the refusal because the belief of any religion we need to be very respectful. This is what the ethics will let you and will be make you. Now, this legislation does not cover a non-emergency treatment. For those situations involving children, advice should be sought from the guardianship board or in Victoria, Queensland, Western Australia, Tasmania, and Australian Capital Territory. Then we need to transfuse the blood because that's what I'm telling you. In the case of child, when the parents was denying and the child is on the verge of dying, you need to transfuse the blood. So these are the Victoria, Queensland, Western Australia, Tasmania, and Australian Capital Territory. Blood transfusion may be given a life-threatening emergency without the consent of the patient. So these are the territories where they are giving the life-threatening, when there is a life-threatening emergency, they are giving the treatment without consenting of the patients, parents, because in a child case, they will not listening to anybody. They are just transferring it. Also, if there is an adult, in the adult, you have to respect the patient's wish. If it is competent, remember my words. Alternative option they will give you in the exam, they will not give you the transfer the ringer lactate, or they will give you the hemexil. They will be an option because they want to judge you on the behalf of ethics, not on the behalf of medicinal point of view, because this is the ethical question, right? So they will ask you to provide the alternative, respect the patient wish and provide the alternative. This is the best option to choose in the exam. They will not give you that patient is refusing it, what to transfuse. They will not ask you to what to transfuse. They will let you ask you that are you able to know the ethics, what are the ethical point of view. So the ethical thing is that, because this is the ethics chapter, right? And this question is from the ethics. So what they want to ask you, respect the patient's wish and transfuse the other alternative. Or there will be a question if they say that a patient is on the deathbed or a hypovolemia, the first is to assess the mental capacity. If he is refusing for the blood transfusion, are he is able to, in the sense, maybe he is in hypovolemia, maybe he's in delirium state, maybe his mind is not working. This is also the case. Yes, because we need to respect their wish. If adult is competent, we need to respect their wish. Okay, so working in the ED and GP practice, you come across the legal and ethical battle as whether or not to involve the guardianship code in the case of minor that refuses the treatment. So, in which of the following you will seek advice? Yes, doctors. Yes, doctors. Yes, very good, Dr. Ajmal. If you see, these are all the things in which you are seeing the minor, 15-year-old, that is the minor who is having a postpartum Jehovah's Witness, leak competency patient that refuses transfusion despite of massive bleeding. In this way, you need to ask for the guardianship from the court because she is the leak competent as well, and despite of massive bleeding, she required the help. So in this way, you require the for this to take the matter to the guardianship court because she's a minor, 15-year-old. Getting my point? Okay, so this is also a very interesting question. If you answer this question, that means you understand the refusal and all the Jehovah's Witness and everything. So, a 49-year-old married male is brought to the emergency department with internal bleeding from injuries sustained in a motor vehicle crash. The patient has been stabilized but require a blood transfusion to replace the lost blood and to prepare for surgery. One thing, they see the age of the patient. Another thing, he is having the RTA. Second thing, he required the blood transfusion not for the requirement right now, but for the surgery as well. So make this thing in mind. So when approached to consent for transfusion, the patient refuses, stating that it is forbidden by his religion. The attending physician called for a psychiatric consult. The psychiatric fellow on call proceed to the emergency room. So, as which of the following is the most appropriate first step in the evaluation of the patient? Dr. Imran, assess the patient capacity is the first thing, right? As we told you that there's a loss of blood. So talk to the patient about blood substitute will be come on the second step. First step, you need to assess the capacity. While you are assessing the capacity, this is the question you can ask on the assessing the capacity, that what type of blood substitute require. You cannot ask from the patient. This will the you have the lab values with you. On the basis of their lab values, you will give the substitute to the patient, because patient is not the doctor, you are the doctor. You will not ask that which substitute you will be taken. Getting my point? So the first thing is you need to assess the mental capacity. Getting my point? Okay, so this is what the answer is, to assess the patient's capacity of getting the refusal for the treatment. Now, this is what the Gleek competency we will do in the next lecture, because this is very important. This the question can come from this thing a lot. We will tell you on the next lecture. We have next lecture on 22nd of Feb. So we will continue from this. We will tell you that what is the Gleek competency, what age is required, because last month the question come from the Gleek competency, right? Up till now, any question from anybody who has joined the course and who has not joined the course yet can ask any question. Dr. Imran, my question from you is that are you from my regular batch or are you just joined from the online? Dr. Ajmal, you want to see this question or a random question? Okay, Dr. Imran, hope to see you in our next page as well. If you like the lecture, I wish you will continue this lecture as well, so you will understand the ethics and all the ethical practice as well. Yes, dear doctor, you will get the slides as well. You will get this PDF as well on your portal if you are from our batch. Dr. Sufyan, you will provided everything in the course detail. Just message on the course number what is providing in the given below. Yes, Dr. Chris, if you are from our regular batch, your all of the things will be provided in the in your Telegram portal if you are from our batch. Okay, so you have problem in this question. Okay, one thing is that why I told you two things. In this question, there is nothing mentioned about the advanced care directive, right? And when there is nothing mentioned about the advanced care directive, we need to assume it as well that maybe it is to given to the wife. Or if we don't assume it, the what I told you, the hierarchy is very important. For the wife, there is always the husband. For the husband, there is always the wife. The hierarchy is very important. If they say the wife was dead or something, then we will consider the son. Again, but whenever there is a matter of conflict come to the point, there was not a matter of conflict. The wife simply says, the husband tell this thing to me and I want this. And son says to save the life of my father. But there was a written in the above line that there was a decreased conscious level already hematoma was developed or something like that. That means there is a no consequence of any treatment. The hospital is also in the favor of the wife as well. Okay, so remember one thing in the exam, nobody can ask you the family code, the food code, the guardianship code, the legislation code. They are not expecting you to be familiar about the topic of the court, right? They want you to be know that are you able to understand that when you have to send the patient to the court or when you have to solve the matter by yourself. So in the exam, sometime they will mention you the guardianation code, sometime they will change the terminology, mention you the family code, or sometime they will change you the terminology and say tribunal. Nobody can ask you to be supervised in what type of court and how many type of court is there. Nobody can ask you the law, but they will ask you to are you able to send the matter code when it is required or not. That are you a safe doctor to know then when you have to send the matter to the court. Family court means you are the family, your matter are going to the family court. Guardianship court is still means that you are the guardian of a person, you are going to the court. They just want to be familiar that are you a safe doctor to send the matter in the court or not. In the option they will mention you the family court or the guardianship court. It is not like that are you sending the patient to the tribunal, are you sending to the patient to the family court, are you sending to the patient to the guardianship court. There is not such option like that. One option from the court, other option is follow the wife, other option will follow the son, other option is let the patient die, other option is do nothing. These are the option they will give in the exam. Okay, a girl who is a down syndrome, a girl know that her baby is having a down syndrome and she come to you and she want to abort. You are going with the girl, but there is a two thing, there is a matter of controversy. It is in the last line it is mentioned that I am the doctor who believe that abortion is a killing of a child. What you will do? Because AMC will never give this a simple question. Because if a 20-year-old girl is coming for you for the mind of abortion, in this question there is no option to go for counseling. Because girl have a valid thing that I have my baby is having a Down syndrome and I don't want to born that baby. So she is on the correct verge. In this way, don't go for counseling, right? But if it is mentioned that you are the doctor who believe that killing a baby, aborting a baby is a crime, then best option for this girl is refer the girl to another GP or another gynecologist. Because you are the gynecologist or you are the person who believe that abortion is the killing of a child. You are not even sharing a similar thought as of a girl. You are not even in the shoe of a girl and you are not even thinking about a girl that making or born a baby who is having a mental retardation is equal to 100 babies. You are not into her shoe. You are not into her page. You are not having a similar thoughts. So best is to refer that girl to another woman because she already make a mind for the abortion. So there is no matter of doing the counseling because she is on the right page and you are on the right page as well because in your belief killing aborting someone is on the type of killing. Getting my point? Any other question anybody want to ask? Today just because we have a first session, so we I already give you the some briefing about the how to book the exam as well. In the next session, we will completely give the 2.5 hours for our ethics. So we will maximally cover the ethics in our next session, and then we have the other sessions as well. So are you guys are clear today? Those who are having our regular students? If still you guys have those who are our students, you guys have a Telegram and WhatsApp group as well. If you still have any query, you can ask me personally as well. And I know it is very draining. Okay, doctor, what is your name? Samsung 55. There is no as such a book we will go for the ethics, but if somebody wants to read it, you have enough lecture. You have enough lectures from my slides. I have put all the guidelines. Dr. Ajmal, they will be share a link with you and you will be join the main Telegram group. Don't worry. You are our from regular batch and they will give you a group as well. So we will do the Conrad Fisher as well. For the USA book, we will do our medico legal Australian guideline book as well, but it is a very huge book. Like it is a book of couple of 1,000 to 2,000 pages, so you will get confused because there are also the laws stating whether law 2.25 selling of egg is not allowed. So this is what Conrad Fisher is kind of easy, but the Australian medical legal book is very tough for you. If you want it, it is 1,000 to 2,000 pages of book. And up, if you wanted to do it, but my lectures are from the Royal College of Medical Ethics Practice and that book as well. So it is all compiled over here. Just do it, make your concept clear, and practice the question that is given in the bank. Because if you want to study a book of 2,000 pages of a single subject, you have a 8 or 9 subject to cover in the AMC, right? Doctor, these are the sharing of slides and timings of the thing that will be just message your AMC customer support that will provide you all the details, right? The bank will be QBank will be provided on your portal. Just message on your support group, just message on the group you will join. They will tell you that when the lecture will be uploaded, where the slides will be given. Also this lecture will be or slides will be given once I will complete the topic. After 22 Feb, once I complete the topic, you will get the slides as well, but recording you will get today. Just ask on the customer support group. They will guide you regarding every query, regarding the question bank and everything. Any other question? Okay, good to see everybody, the new batch as well, and the person who joined for the first time. I wish you see in the next batch as well. It is 4 to 5 months of the regular course, and I guess 2 months for the recall course. And in the recall course, we will do the lots of PCQs just to make you prepare to sit in the upcoming exam once you have done our regular course. Hope you like the lecture. Wish you to see in the next class as well. Ethics will be draining, but we will make it together. If you want to ask anything, I am available for you in the group. So, goodbye, everybody. It's a lovely meeting for you for the first time. And again, welcome you all for our regular batch. Have a lovely day and as well the weekend. Goodbye, everyone.